My name is Alice Floyd, and I work in the Center for Emergency Preparedness, and I'm the Operations Director. I'd like to talk to you today a little bit about medical needs shelter training, and will provide an emergency response overview for 2017. Funding for this presentation was made possible in part by the Centers for Disease Control and Prevention. The views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. I'd like to talk to you a little bit about the overall response overview that we have for the department, and then I'll make introductions for other subject matter experts that will be providing information on medical needs sheltering. In the past years, and even as recently as in the past few months, Alabama Department of Public Health has been involved in a variety of responses from disasters, including tornado outbreaks, flooding, infectious disease, environmental disasters, and other types of response. All employees need to be trained and prepared on how to respond. This not only includes from the work perspective, but as an employee, you and your family should be prepared for a disaster. Alabama Department of Public Health is the lead agency for Emergency Support Function number 8, which is Public Health and Medical Services, in the State of Alabama Emergency Operation Plan. Therefore, ADPH staff may be called to respond to emergencies. Just a little bit of information about the response structure that Alabama Department of Public Health uses. It's a scalable, flexible, and adaptable concept known as the Incident Command Structure, or ICS. Within Incident Command, we use the system to manage the incident to support the outside partners or even our own department to respond to an emergency. ADPH employees are required to take National Incident Management System training, or NIMS training, in preparation for response. Depending on the level of response would depend on the level of training that you would need to have. We have a NIMS compliance officer that helps monitor for these trainings to make sure that we're in compliance and that information is tracked and reported. So if you're a new employee, you will have several classes that you need to take, and then as an employee, if your responsibilities were to change throughout a response, then you may be requested to take additional training. When we respond, we are not alone in our response. We have planning and response partners which help to make our pre-event, during event, and post-event more manageable. We work with the state and local governments. We work very closely with the Department of Human Resources, both at the state and the local level, and emergency management, again, at the state division and the local level. Healthcare providers are included in our planning and response for any type of emergency or disaster, and those include healthcare providers, hospitals, emergency medical services, nursing homes, and that list is getting bigger as we implement our healthcare coalitions. But these are some of the agencies that we would work with in advance and contact during an emergency or an event, and then work to resolve the health and medical issues that are out there that may have occurred because of the disaster. We also work with nonprofit agencies, including the American Red Cross and the Salvation Army, and there are others that we've not listed, and then our federal partners. Speaking of our federal partners, the Center for Emergency Preparedness receives emergency preparedness dollars through 2 grants through our federal partners. The Centers for Disease Control and Prevention, or CDC, provides a Public Health Emergency Preparedness, or FEP, grant, and then the Assistant Secretary of Preparedness and Response, or ASPR, also provides a hospital preparedness program. With these dollars, the federal dollars, we pay for the Center for Emergency Preparedness staff. We also help to support salaries for nursing, social work, and pharmacy. We also provide partial salaries or salaries for information technology staff who will help us during planning and disaster response. We have funds that go to infectious disease and outbreak staff, and then we have area emergency preparedness, or EP teams, which will be changed to the district areas once we change into our new districts. Response in itself, there are different types and there are different levels that we would respond. types that we plan for are all hazards, and that means that we don't just sit down and write out a plan specific to one particular type of scenario. We try to be more inclusive to include natural disasters, radiological emergencies or events, chemical emergencies, biological, and terrorism. As an employee, you may be requested to assist at the county level, at the area or the district level, at the state level, and then we also have a FEMA Region 4, which we have recently deployed some of our staff to assist with Hurricane Matthew. So it may be that you would be asked to just do extra duties at your office, or you may be asked to go out and help to assist in any of the different types of levels of response. Our FEMA Region 4 group requested assets for Hurricane Matthew, and we deployed a medical needs shelter team, 2 of those, and nurses and a strike team down to Florida to assist them with their responsibilities, which would be public health and medical services, for sheltering in October. For the people that went on that deployment, for the very most part, most of that was very good response. They enjoyed it, and many of the folks that returned stated that they would do that again now that they understand a little bit more about what response is and how medical needs shelters do work. So for your response duties as an employee for ADPH, it may be that you are just asked to go in and do your job, but possibly just more of it. Typically, if we go into a response, sometimes we may be asked to work 12-hour shifts. So if you're not on a response team, or if you're not called out to respond outside of your office, you may need to help to cover more of clinic operations or more of the duties that a coworker would do if they get pulled to go into a shelter or to go into an emergency operations center. Emergency operations centers are where our staff would go to help work an event, to work on the needs, to determine what resources are, and to determine how they're going to support that event. And there's different levels of these. There may be a public health emergency operations center for the area. There may be one that you would need to go to support for the division, with the division construct from the Emergency Management Agency. It may be typically the people that go to the state level emergency operations center from our office are out of the Center for Emergency Preparedness, and they would go up to the bunker in Clanton to help support. And usually that is going to be a very large event, and we will have multiple emergency operations centers potentially open throughout the state, which our staff would help to support. And then we may ask that you just do a team deployment. That could be a local team, it could be an area or a district team once we change to the districts, or it could be out of state for an Emergency Management Assistance Compact or an EMAC request. Typically those would come in on the very big type of disasters that we're working, and that takes a little bit of time and notice, where we would have to determine who the team would be going out and then coordinate those logistics once the state requesting assistance determined what they needed, and then we replied back what we could support, and then they accept that. So typically there's a little bit of lead time for those, whereas a local deployment or an area deployment to an emergency operations center or as a team could be on a much more rapid scale. For response, we will always want to make sure that our employees are safe, and so we encourage working safely. During a response, we would have a safety message to go out to identify hazards that may be out there, and we want safety to be everybody's responsibility. To be discussed in the medical needs shelter training, there is a safety officer, and more information will be given about that. We also want to make sure that you code your time as instructed. Typically when we have an emergency response, if it's large enough, we'll be given a special time code, and you would need to include that on your ECATS reporting or your reporting systems to make sure that we capture that. We don't always have a funding code for that if a disaster is not declared. However, we still would want you to code your time, and that would be information that would be pushed out at the time of the event. Please realize that if you are deployed, or if you're on a team, or you go out and we're an incident command structure, that your supervisory chain may not be what your supervisory chain is day to day. Once we activate and we go into ICS mode for a response, the structure changes. So if you're at a team, on a team, you may be from one area and you get transferred to another area with that team for that response. Your supervisor is not going to be your day-to-day supervisor at that point. We also want to make sure that you as an employee continue or maintain your alert profile. The Alabama Emergency Response Technology, or ALERT profile, is a way that we would make notifications to an employee about any impending disaster response. It may be that you would be notified not to come into work if there's winter weather. This is the way that we can communicate with our employees, and it's done on a mass scale. So you need to make sure that your information is up to date so that your contact information, if you have set your profile up to receive calls or text or emails, comes to the right person. And always, if you receive an alert, please acknowledge it. And there is more information about that on our homepage under Login for Alert. If you have questions, you can go there. So, but remember, please always acknowledge the alerts that are sent out. So a little bit about sheltering. We work in conjunction with several agencies, including the Alabama Emergency Management Agency and the Alabama Department of Human Resources. And we have other agencies that we work with to help to meet the needs that would potentially be there if we had to open up a medical needs shelter. We have a state planning group that goes out to identify and locate shelters that may serve as medical needs shelters. And we do that pre-event almost all the time because we want to be able to make sure that the needs for particular items such as generators are there, or they've at least had an assessment for that. These are things that are very difficult to do at the time of the event. So where we can, this planning group goes out from the state level, and we also meet with the area and the county representatives of these agencies to sit down and discuss the responsibilities for each of our agencies should we need to stand up a medical needs shelter. We work hand in hand with DHR, who helps with registration, and they also help with the feeding. They have agreements with Red Cross and other agencies that can help with the feeding process. We also want to make sure that particular items such as power, such as security, and other items are covered when we go into a shelter, to make sure that if we have to stand it up, that we've addressed as much of as many of the issues as we can to make sure that that would be a successful event. Sometimes we may be asked to stand a medical needs shelter up pre-event, but that's not usually done. We don't always know where the disaster will be. It may be that if there were to be a mass evacuation, that would be a circumstance where we would be asked to stand one up, or if we know of another potential source of a disaster where power outages for many days could be out, we may be requested by the governor or Dr. Miller to stand one up. But we typically are always working with our local partners when we go out to identify the shelter locations, and that is not put out for public knowledge just because we don't anticipate always opening one, and we do not want people to go to a shelter in advance just knowing that there has been one that's been identified where we don't plan to open it up, because that could potentially have somebody in a dangerous situation. So that's a little bit of an overview about emergency response for the Alabama Department of Public Health, and I hope that that was informative to you. If you're a seasoned employee, that may not be new. If you're a new employee, hopefully it'll give you a better understanding of what it is that we do during response. Not only do we look at shelters, but we also have a lot of things under health care that would be our responsibility, and there's a very long list of those, which I won't go over today, but just be aware if it's involving health care, if it's involving the public, if it's involving things that could be a problem during disaster, even if we're not called to respond to, if the needs are met at the local level or within the local response, we would still like a heads up on that, because sometimes if there's not good communication during a disaster, we don't have complete situational awareness. So we always encourage that information to be passed up and through the chains of command so that we can have good visibility over what's going on throughout the state. So now I would like to introduce a couple of our speakers that will be giving very specific information as it relates to medical needs sheltering. The first person I'd like to introduce is Marilyn Knight, and she will be presenting information on the nursing component for medical needs sheltering.
Hello, my name is Marilyn Knight. I'm the nurse educator for the Alabama Department of Public Health in the Office of Clinical Management and Practice, and today we are going to be looking at information concerning medical needs shelters. For Alabama Department of Public Health employees, you can find the Shelter Operations Manual in the document library for more information. So today we start with defining what a medical needs shelter is. A medical needs shelter is a shelter of last resort for persons with conditions requiring minimal nursing oversight who cannot be accommodated in a mass care shelter. So back in 2006, we as the Alabama Department of Public Health accepted the responsibility that we would be the ESF 8 responder, and the Emergency Service Function 8 deals with public health and medical oversight. So as the Alabama Department of Public Health, we coordinate and we run medical needs shelters. In the event of an emergency, a medical needs shelter will be opened for individuals who meet this definition. Medical needs shelters provide services during an emergency in an environment that can help individuals sustain pre-disaster levels of health. So if we open a medical needs shelter, when we operate within that shelter, we provide services for individuals who cannot be accommodated in a mass care shelter, and also individuals who may not have maybe power or the things they need in their own home. So we try to keep them at the level of health that they are before the disaster has taken place. So, medical needs shelter population. Types of people who may require services or need to be admitted to a medical needs shelter include some of the following. Individuals with health and medical conditions that require professional observation, assessment, and maintenance, but do not require institutional care. For example, this could be maybe a person who has diabetes and they manage themselves well at home, but maybe in the emergency their home or their community was affected and it's no longer safe for them to stay in their home. These type of individuals could be admitted to a medical needs shelter where we could observe them and help them to maintain their pre-disaster level of health. You may also see individuals with chronic stable conditions who may require assistance with the activities of daily living but do not require institutional care. In this instance, you might have an individual maybe that lives at home, and maybe this person has mobility issues and requires assistance to take a bath, or maybe assistance to go to the bathroom or something of that level. In a medical needs shelter, these people could be admitted and cared for because they only need assistance in the activities of daily living, but not to be admitted to something like a hospital or an assisted care facility. You may also find individuals with contagious health conditions that require precautions or isolation and who cannot be cared for in a mass care shelter environment. An example of this population may include maybe someone who is newly diagnosed with tuberculosis. That person needs care. They need to be isolated if they're still in the stages of being contagious, which we wouldn't want to put them in a large mass care shelter with 200 to 500 individuals that disease would spread through. We could take that person into a medical needs shelter, isolate them, and care for them during the emergency event. Okay, so now let's look at medical needs shelter stand-up. We always start medical needs shelters or open medical needs shelters with the activation phase. During activation, there's an order by the state health officer in response to a request from the governor. So if there was a weather event, say a tornado or a hurricane, and after the event has passed, there has been damage in an area, and the need for a medical needs shelter is there, that request would come down from the governor to our state health officer, who would then send that information through the Center of Emergency Preparedness. The advanced team would be deployed for an event where there is time. The advanced team is a team that was created that in the event a medical needs shelter needs to be open, they would go ahead of the team that is going to work the center to set up the medical needs shelter, put out all the cots, and have it ready so the response team that comes in would not have to set up the shelter and then go into working the shelter. Once the advanced team goes in and they set up that medical needs shelter, if time should permit, then the shelter operations team is deployed to work within the medical needs shelter. The advanced team sets up the shelter, including the layout for patients and employee designated spaces. They set up the people tracking system, supply storage, and the communication systems. During the operation phase, routine management of the needs of shelterees, caregivers, family, and the shelter staff are managed. In the operations phase, the nurse manager and facility manager review the layout and make adjustments if necessary. So in the operations phase, if the advanced team has already set that medical needs shelter up, the nurse manager and facility manager, when they come in to begin operations or providing care and services, they would review the layout and make sure it works for the patients that are going to be seen in that site. We also work with partner agency representatives. They respond and begin coordination of services. Agencies may include the Department of Human Resources. We may also work with local providers, maybe an EMT company that would provide services while we're there in the shelter. Once we're in operation, patients are accepted, assessed, registered, and care is provided. The demobilization phase of shelter operations consists of the shelter closing, and that's based on the input of the local staff to the state health officer. In demobilization, the need for the shelter is now over, and patients can be discharged home or to other facilities. Equipment and supplies are inventoried and packed for return, and all shelter records are secured for storage. Okay? Now, when we decide or there's a decision to open a medical needs shelter, the response teams or the shelter operation teams have to be activated. That takes place either through the immediate supervisor, the area administrator or their designee, the state health officer or their designee, or the Alabama Emergency Response Technology, known as ALERT. We have 4 activation status codes. They include standby, alert, duty, and demobilized. When an employee is on standby, the employee is notified that conditions may warrant the opening of a medical needs shelter. They are to stay situation aware and be prepared if a medical needs shelter has been requested to be opened. When we're in the alert status, we have been notified that a medical needs shelter is being opened, and the employee will be given information on where to meet to respond to the event and be given a time and duties that they will be asked to perform during the operations phase. The duty status is when we're in the operation phase actually providing on-site care to shelterees, caregivers, and family. And demobilized is when the event is over and now the employee will be returning back to their home and back to their county to resume normal duties and services. The team composition. When we open a medical needs shelter, the deployment of the team is based on the capacity of the structure. We have 3 teams. Level 1 can care for up to 25 shelterees, level 2 from 26 to 50 shelterees, and level 3, 51 to 75 shelterees. And that's based on the number of individuals that can be seen at that facility. Acuity will be taken into account after the shelter is open and shelter population is evaluated. So in the case that you open a shelter and maybe your facility can take up to 50 shelterees, but based on the level of care needed for every person, based on their condition, maybe that shelter may only take 25. So they do look at the medical status of each patient before they decide the number of shelterees that they can take into any particular shelter. For our organizational structure in a medical needs shelter, the local area nursing director is the lead for a shelter in the event area. So the local area nursing director where the event takes place is who would take lead in the medical needs shelter services being provided. The shelter nurse manager is responsible for all aspects of the shelter and reports to the local area nursing director. The shelter nurse manager directly supervises the social worker in charge, the shift charge nurses, the safety officer, and the team support officer. The social worker in charge directly supervises the other social workers in the shelter. The shift charge nurse directly supervises staff on his or her shift, including all staff nurses, care assistants, and clerical support. While working in a medical needs shelter, the Alabama Department of Public Health is the lead agency, but we work with partner agencies in order to provide care. The shift charge nurses should be in consultation with the EMT staff based in the facility. So when we open a medical needs shelter, we always want those EMTs on site. EMTs have different protocols, and if an event should arise that are not covered in the shelter operation protocols, then you have additional assistance and help on site to care for the needs of the shelterees. A facility manager from the Department of Human Resources will be responsible for staff from the facility and food service. We work very closely with DHR, and in shelter operations, they are very instrumental in helping us run the facility and make sure that we have food services not only for the patients, but also for the shelter operations staff. In addition, we work with the Alabama Emergency Management Agency, which will be responsible for shelter security. Once we're in the operations phase and we begin to see shelterees or patients, triage and admission is very important. So admission to the shelter is at the discretion of the nursing staff. All individuals that present to the medical needs shelter will be assessed by the nursing staff. We do have criteria for entrance into a medical needs shelter. That is found in the shelter operations manual if you would like to review that. But it does provide criteria by which the nursing staff can review to see if the shelteree or the person presenting meet those criteria for entrance. We ask that any individual coming into the medical needs shelter that their caregiver should be present. Now, the decision to admit without a caregiver is at the discretion of the nurse manager. We know in an emergency event, some individuals may present to a medical needs shelter and their caregiver is not with them. Or you may have someone that come in who takes care of themselves normally at home and they don't have a caregiver. They're just in need of assistance. So that decision will be made by the nurse manager as to admit that person into the medical needs shelter. And shelterees should be able to safely lie on the medical cots provided, and as I mentioned before, triage form for admission is found in the shelter operations manager. Nursing triage. All staff should assemble in the triage area. A triage area should be set outside of the entrance into your medical needs shelter. It should have enough space where all of the staff can meet to review each shelteree and their criteria for entrance. If admission is not appropriate, then we ask that the staff work with the social workers to refer the shelteree to the appropriate facility. Using the medical needs shelter triage form to quickly assess admission needs and have the care assistant take the shelteree to the medical cot. So if a person present, they meet the criteria to enter a medical needs shelter, that person would very quickly be assessed, then taken by the care assistant to lie down on a medical cot. If a person does not meet the admission criteria, do not admit into the shelter. The exception to that is if there is inclement weather or some type of extenuating circumstance, you can shelter an individual in place until that event has passed, and then that person should be referred to appropriate accommodations. Clerical duties during triage and admission. Clerical staff will assess the Alabama Incident Management System and register the shelter. Shelters can be open in multiple areas based on the size of the event. So it's very important that our clerical staff register that shelter, so if a need for shelterees to be moved from one shelter to another, or if the need becomes so great that we have to open additional shelters, we'll know how many we have, how many patients or shelterees we have in those shelters to make the proper decisions. In addition, clerical staff will collect all triage forms, including forms for individuals that were not admitted. They will file these forms in alphabetical order in a folder or notebook and establish a record for each person that is admitted into the medical needs shelter. Clerical staff entered the shelteree and caregiver information into the AIMS people tracking system. That allows us to be able to connect shelterees and caregivers together. Also, that allows us to track the number of people that are in our shelter, so we know if we meet the capacity for that facility, then there will be a need to open an additional medical needs shelter. DHR will be responsible for assisting the clerical staff with the people tracking program, and in addition to that, clerical staff ensure the security of all shelteree records. Once we have someone that has been admitted to the medical needs shelter, then an initial nursing assessment should be completed. The medical needs shelter admission assessment form should be completed for each person admitted, and a problem-focused assessment should be started within an hour of admission and must be completed within the first 24 hours that the shelteree is admitted to the shelter. Once the person has been admitted, nursing rounds will be provided by the staff nurse, the charge nurse, or the nurse manager. Documentation of any care provided will be done so on the medical needs admission assessment form. A medical needs shelter note page can be added if additional documentation space is needed, and documentation of the caregiver should be performed as well if the condition of the patient. Documentation is not required unless there is care provided. Other protocol to be found in the medical needs shelter manual includes isolation of shelterees, medication management, emergency purchasing, guides for donated food, post-mortem protocol, and the nursing protocol. This information is very important to be reviewed if you are in the operations phase. Based on the need of the patient, this protocol will be available to you to help guide you in providing care in a medical needs shelter. Forms that may be needed and forms that are found in the shelter operation manual include the medical needs shelter triage form, medical needs shelter admission assessment, the medical needs shelter notes, social worker intake, normal reactions to an abnormal event, the ADA compliance tip sheet, the donated food checklist, and the shelter environmental health assessment. And in each medical needs shelter response, this information will need to be documented. While we, as the Alabama Department of Public Health, we manage medical needs shelters, mass care shelters may also be operating at the same time. This emergency service function 6 is the responsibility of other agencies. ADPH operates in a support capacity, and ADPH staff participation is limited when it comes to mass care shelters. For mass care shelter evaluation, Once again, that participation is limited to once daily rounds. Your nurse manager or their designee may be instructed to evaluate shelterees in the mass care shelter to determine if they meet the criteria to be moved into a medical needs shelter. The county or area staff can establish that daily visit schedule, and they instruct the on-site manager to call the local emergency medical services if needed. So we would not expect someone in a mass care shelter, if an emergency situation should arise, to wait for the Alabama Department of Public Health staff to do rounds. If an emergency situation is taking place, they can call the emergency medical services. The nurse should evaluate the mass care shelter resident to determine if first aid or transport to a medical facility by EMS is appropriate. The person can be taken to a medical needs shelter by a family member if they meet the criteria for entrance. The social worker should determine if appropriate intervention is being conducted and assist where needed. The nurse should complete a mass care shelter nursing intervention form if care is administered, and this form can be used by nurses and social workers. Thank you.
Thank you, Marilyn. I appreciate that information. Next, I would like to introduce Renee Carpenter, the State Social Work Director from the Office of Clinical Management and Practice, and she'll be speaking specifically about social work during medical needs sheltering.
Now let's talk about the social worker's role in medical needs shelters. No matter how many times you respond to a disaster or to a medical needs shelter, you're never going to have the same experiences twice. And I know that that creates a lot of anxiety, especially for those of you who have never responded to a medical needs shelter. Oftentimes I'm asked a lot of questions about what will I do when I get there, who knows what I'm supposed to be doing, and the only thing I can tell you is right now I don't know, and that's because every disaster is different. What I can tell you though is that you have the skills you need to go in and do the assessment and then create the intervention. It's just like another day at the office, it's just in a different setting. So to start with, let's talk about triage. First, you will assist the nurses with the referrals. And anytime there's a referral of a patient who's coming into the shelter, we need to begin discharge planning at that moment. You do the assessment, a very quick assessment, not an in-depth psychosocial assessment like what you're accustomed to doing. This is a very brief assessment for whatever those needs are at that moment. And go ahead and start planning for discharge. This is a temporary setting. So you will use the social work intake form, which should be completed, and it's added to the shelteree's record. And you will need to assess for psychological distress and implement psychological first aid as needed. Now, as soon as possible, complete the social work assessment, and this is documented on the social work intake form. Again, it's not a huge, in-depth psychosocial assessment. It is a very brief assessment. But every patient who comes into the medical needs shelter will need to have a social work assessment. Then you begin the initial discharge planning. Most of these patients will be able to return home as soon as the disaster is over. There may be times when that discharge planning is for a long-term care facility, perhaps a nursing home placement, or maybe even being discharged to a hospital setting. Occasionally, there will be the patient that needs to have a psychosocial assessment. And again, this is most likely going to happen when we are discharging a patient from a medical needs shelter into a long-term care facility, because there will need to be more documentation at that point. There will need to be probably some medical records will need to be obtained, and those will also need to be sent along. So having that psychosocial assessment completed and available will help the people on the receiving end of that. And this is all documented on the medical needs shelter notes. As far as ongoing social work care, you may have to make rounds as needed. Now those rounds, again, depending on the disaster, those rounds may be in the medical needs facility, the medical needs shelter, But it could also be at a hospital setting where you are making rounds, perhaps with a nurse, to assess for patients who may need a step-down situation where they can be discharged from the hospital, but they can't go home, or maybe they don't have a home to go to. So that's the purpose of rounds. So just know that you may be asked to complete rounds in a hospital setting or in some other setting. You will need to interact with the shelterees or in their behalf if they're not able to be intervened with at that moment, particularly if they're in a different setting. All of those interactions will need to be documented on a medical needs shelter admissions assessment. And again, this is all a part of the admissions process. Use the normal reactions to an abnormal event reference. That's also in the medical needs shelter manual. You can also use the shelter resource manual as needed to find local resources for assistance. Most likely when you have a response, when you are sent somewhere else, you are not going to be familiar with what resources are available in that area. So our resource directory, which is located on the document library, is there for you, and it is set up in a way that you can pull out the counties that you need in order to provide the best services to the impacted area where you will be sent to serve. I hope this information has been helpful. I know it was very brief, and I hope it didn't create any additional anxiety for you. But again, every disaster is different, so use your assessment skills and create the interventions that's needed at that moment. Thank you.
Thank you, Renee. I appreciate your information. Next, I would like to introduce Tim Hatch, the Director of Logistics and Environmental Programs in the Center for Emergency Preparedness. And Tim will talk about the environmental piece of medical needs sheltering.
Thank you for joining us this afternoon. I'm going to be talking to you about what I think is one of the most important team members for the medical needs shelter response team, and that's the environmental health professional. Every team will have an environmentalist on it, and what we want to be sure is that not only the environmentalist knows what they're going to be required to do, but also the other team members, so that they can rely on that person to conduct certain skills that are maybe outside of the medical profession. Each environmentalist on the team will be responsible for the safety and sanitation of the shelter, as well as looking at those items that are consumed by the guests and our other response team members. The county environmentalist that is deployed will most likely be from outside of the disaster area. We try to deploy teams from other parts of the state to allow those who are locally that may have personal issues with the disaster to deal with. But the environmentalist will do something very similar to their daily job, and that is to look at the food that is brought in. The food and water are very important, not only for the guests, but also for our fellow responders. The environmentalist will do daily checks, which we'll talk about here in a minute, but also they're responsible for determining the condition and the acceptability of donated foods. In your medical needs shelter guidelines, you have a donated food checklist that the environmentalist will use to evaluate those items that have been brought to a shelter. Now, we in the environmental community have a term that's, when in doubt, throw it out. And that's kind of the idea that we have behind accepting donated items. I'll tell you a quick story. After Hurricane Katrina down in Fairhope, Alabama, we had a medical needs shelter set up there at the community center. Fairhope has got to be one of the most warm and welcoming communities that we have, and having said that, there was a ton of donated items. Now, they donated everything from clothing to bottled water, medications that were needed, and yes, even the occasional casserole. We had a lady come in one day and had a very nice casserole and brought it to my attention, and I thanked her, and as soon as the taillights left the parking lot, that casserole unfortunately went straight to the garbage. Not that I thought that the lady was unclean or was trying to make any of our residents or staff sick, but the important thing is we as environmental health professionals cannot confirm that the conditions in which that item was cooked or the temperature time that when it was brought out of the oven It may have been in a refrigerator or freezer for days or weeks. Maybe she cooked it last Tuesday and it's been in her car. We don't want to have the situation to where a foodborne outbreak is in our shelter due to us accepting some of the donated food. So it's very important that environmentalists do evaluate those items as they are brought in for their acceptance into the shelter. The end of that story is that the next day the lady came back with more donated items. Luckily, these were like potato chips and bottled drinks, but she asked how her casserole was received, and I, of course, very kindly told her thank you again, and it was wonderful. And then she asked for her spoon back. So the environmentalist needs to be quite careful of making sure don't throw away any of the personal items when the donated foods are discarded. So we talked about the environmentalist being responsible for everything environmental health related. Food, water, air, general cleanliness, sanitation, even the restrooms or any public areas. But the environmentalists may also be used in a capacity outside their normal job duties. One of these might be the safety officer. You've heard previous presenters talk about the importance of a safety officer on a medical needs shelter response team. And this is a good fit for an environmentalist. If the safety officer is an environmentalist, he or she may be asked to conduct a health assessment. The health assessment sheet is also located in the back of your medical needs shelter manual. This item was taken from a template offered up by the CDC, and it basically does a complete facility inspection. Now, before a medical needs shelter is even opened, it is identified and evaluated as its effectiveness and whether or not it would serve well as a medical needs shelter. So environmental health staff has been inside of each of the medical needs shelter locations already and done an evaluation on both the structure, cleanliness, the flow of patients in and out of the medical needs shelter. But this assessment form allows the environmentalist to look from the front door to the back door of the conditions as they are during the operation of a medical needs shelter. So they will look at the surrounding areas to ensure that there's no harborage for rodents and other vectors, looking for standing water, looking to make sure that the doors are self-closing, and if there are windows that are openable, they have screens on them. They also look at the water supply, the sewage, to ensure that it is properly disposed of. They look at the common areas, the eating areas, the food preparation and storage areas. They even look at the bathrooms to ensure that there's enough toilet paper, that the commodes are clean and in good working order. This is the role of the safety officer, but as you can see, it fits in very well with what environmental health practitioners do day in and day out. Another area that the environmentalist may and has been used in the past is the team support officer. This is the catch-all position that is very important to the functionality of a successful medical needs shelter. Environmentalists are very dynamic individuals. We're trained to be nosy, we're trained to observe and document, and we're trained to prevent health issues before they happen. It's very important that as the nurse manager of the shelter, that he or she has someone that they can rely on in this team support officer role for anything from being a gopher. Maybe the nurse manager needs a certain medication that may be only available at the local pharmacy. There needs to be a team member that can go and retrieve that for this patient. There may be the heavy lifting that needs to be done, whether that's moving items from one side of the facility to the other, maybe unloading vehicles. Maybe it's assisting our nurses in patient movement. There are situations to where it takes more than one person to assist a patient in and out of a cot or a bed, or maybe up and down a hallway, or on and off a commode. So this team support officer is very important, and oftentimes the environmentalist is a perfect fit for this. When an environmentalist is called upon to conduct the environmental health assessment in a medical needs shelter, it's most likely done by the environmentalist that is there on staff, that has been deployed with the medical needs shelter team. As I mentioned a minute ago, there is a evaluation sheet that is to be used on a daily basis. And also, we are called upon at times to provide this same type of environmental health assessment in the mass care shelters that may be opened in our communities. Now, we all know that ESF 6 is responsible for mass care, but we have a working agreement or an MOU with our friends and partners over at Department of Human Resources that when and if they do open a mass care shelter, that public health will support them in any way possible. This can be everything from supplies, staffing, and even the occasional environmental health assessment. When the Red Cross or the local Baptist church or even DHR open a mass care shelter during or after an event, they may call upon public health to help them with daily operations or even this environmental health assessment. And as the slide shows, that an environmental health assessment is a thorough review of the facility for structural soundness, the ability to accommodate the proposed use, which is sheltering individuals, looking at the safety and sanitation of drinking water, food preparation, and overall sanitation services, and this could include laundry or even waste management. When a shelter is opened, generally we will try and conduct a pre-operational inspection for the environmental health and suitability of the facility. They should be completed prior to opening and then within the first 12 hours of shelter operation. What we try to do is the same time frame for our friends at the mass care shelters, and also can be requested by those agencies such as Red Cross, DHR, and our faith-based friends. If the shelters are in a local area, the environmentalists that are based in that county, if they are not assigned to other tasks, will conduct this. If not, it will be done by the environmentalist there on staff. The environmentalist, as I mentioned when we first opened, is a very important and valuable person to have on your team. I encourage you, environmental health practitioners out there, to learn what you can about being prepared to deploy. And those of you who will be deployed with an environmental health specialist, understand that they can do much more than their daily environmental health jobs, as we've seen with both safety officer and team support.
Next, I would like to introduce Elizabeth Williams from the University of South Alabama. The University of South Alabama several years ago developed a software program for us called the Alabama Incident Management System. Within this system, we're able to track information during a response about potential healthcare needs and resources that are available. The system is used throughout the state by hospitals, nursing homes, and emergency medical services to be able to have a very good situational awareness about the healthcare needs that are going on during a disaster. The component that she's going to discuss is going to be our tracking piece. People tracking for our shelterees gives the information that we would need to know to see who's in our medical needs shelters, and she's going to go through the process of getting them registered, how to maintain that information, and how to get them discharged. Elizabeth?
Hello, my name is Elizabeth Williams. I'm the Associate Director, Preparedness Training at the University of South Alabama Advanced Regional Response Training Center. Program Director is David Wallace. And throughout this presentation, if you have any questions and you want to take note, you can contact either David or myself at the email address provided on the screen. Today I'm going to be providing information on the Alabama Incident Management System, known as AIMS. Specifically, we'll be addressing the Medical Needs Shelter People Tracking Module. The objectives of today's presentation is to provide an overview of AIMS and the use of the People Tracking Module, provide information to access, including opening and closing a medical needs shelter within the People Tracking Module, demonstrate how to register shelterees by auto entry and manual entry, demonstrate how to move a shelteree to another medical needs shelter, demonstrate how to discharge a shelteree from a medical needs shelter, demonstrate how to view the status of the shelterees currently registered, move to an alternate medical needs shelter, or those discharged. Before we begin the training, just want to provide a little overview of the AIMS system. AIMS has been in existence since 2002, when the Alabama Department of Public Health Center for Emergency Preparedness received funding to develop a situational awareness tool designed to monitor healthcare facilities' staffing and resource needs during a disaster. At that time, USA ARRTC was awarded a grant to write the code and develop the software for AIMS. Today, we continue to maintain and manage the AIMS program. Today, we will look specifically at the medical needs shelter training and how to track people in a medical needs shelter. Those who we will track are those including the shelteree, which is known as the patient, as well as the caregiver, the family, or friends associated with the shelteree. The Center for Emergency Preparedness will provide a username and a password to the shelter nurse manager for the medical needs shelter. At any time you are working a medical needs shelter and need assistance with AIMS, you can contact AIMS technical support by emailing support@aimslive.org or calling 251-461-1805. We're going to review how to access AIMS and how to set up a medical needs shelter within the module. To access AIMS, you will log on to the Alabama Department of Public Health website at adph.org and click on the login at the top right-hand corner of the page. From there, you will click the Alabama Incident Management System AIMS link. This will prompt you to enter the username and password that was provided to you by the shelter nurse manager. Once you log in, you will have access to what is known as the dashboard. And this is a view of the dashboard once you have logged in. When the dashboard has been accessed, you will want to confirm the location of the medical needs shelter. This information is displayed at the top right corner of the page. The shelter must then be opened in AIMS. This is done on the left side of the screen. Click Status, then Update, and choose to click Open. If needed, you may add a comment in the notes field, such as your name and the time at which you're opening the shelter, and then click the Send Update button on the right side of the screen. The message Status Updated Successfully will appear at the top of the page in a green message bar. Once this has been completed, you will plug in the symbol scanner by inserting the scanner's USB plug into the computer. The scanner will beep when it connects to the computer. Once you hear the beep, you will now be ready to begin registering shelterees. We will now begin instructions for registering people in the People Tracking module. The People Tracking module allows staff to register and track shelterees and the caregiver. The shelteree or caregiver can be added to the system manually or automatically by using an Alabama driver's license. Driver's license from other states may not populate, therefore the manual method should be used for data entry. If a person is already registered at this or another medical needs shelter, the system will give an alert. Shelterees are tracked by their AIMS ID wristband. A complete list of people admitted and current shelterees, including the patient, the caregiver, family, or friends, will appear on the People Tracking screen. All messages regarding successful entry will be displayed in a green message bar at the top of the screen. This is a screenshot of what a successful entry will look like, as well as the list of current shelterees as they are registered. Moving along with registration. To register people who are to be admitted to the medical needs shelter, from the main menu, click Situation and select People Tracking. Click the Add a Person link at the top right side of the People Tracking screen. Each person can be registered using auto entry or manual, or can be registered manually. The shelteree must be registered first before the caregiver. Shelterees should be registered in the following manner, using the auto entry with an Alabama driver's license. Place a cursor in the auto entry field and scan the barcode on the back of the Alabama driver's license. The auto entry field will populate all required information for the shelteree. The driver's license number will be inserted into the ID number field as indicated on the screen. You can place the cursor next in the Ames ID wristband field. Scan a new wristband. The wristband number will automatically appear in the Ames ID wristband. Again, this is the method that tracks individuals in all the medical needs shelters. Once you have done this, you will write the name and the date of birth of the shelteree on the scanned wristband and then place it on the shelteree. Once you have done that, you will scroll down to the existing medical record and use the down arrow to select the following options. They do not have a medical record, none, or they have a paper or an electronic. This has actually been added for future use, as currently we do not use electronic medical records in a medical needs shelter. From there, you will scroll to the patient option, which will default to yes. The comment space is provided for any pertinent information that the shelter staff deems appropriate. An entry is not required in this field. Should a patient or shelteree not have a caregiver present at the time upon registering, click Save. A message will appear stating that the person's record was saved successfully. Next is the auto entry registration for a caregiver with an Alabama driver's license. As stated prior, the shelteree should be registered before the caregiver. When all the information is entered for the shelteree, instead of clicking Save, you will click on Save plus Relation. When you do this, a new screen will appear with the message Person Record Saved Successfully and a data entry field to add relation to the shelteree. Complete the registration information for the caregiver using the Alabama driver's license. In this situation, because you have already added the shelteree, the patient will default to no. A check mark is automatically inserted to add relations. The Ames ID wristband of the patient that the caregiver is being linked to will automatically appear. In the relationship type box, click on the down arrow to select Caregiver and select Save. This is a screenshot of those steps of adding the caregiver relationship to the shelteree. The caregiver's name and the shelteree's name should be written on the caregiver's wristband. If adding additional relationships, such as a family or friend, to the shelteree, instead of selecting Save, you will select Save plus Relation and continue the same process until all relationships have been added to the shelteree. As with the caregiver, write the name of the family and friend or friend on the shelteree's wristband. The next section is how to manually register the shelteree and the caregiver. Instructions for adding a shelteree or caregiver who do not have an Alabama driver's license are the same as adding them automatically, except that all information on the person must be entered into the system manually. We will now address how to add or link a caregiver who presents after the shelteree has been admitted and entered into the system. You will add the caregiver automatically with an Alabama driver's license or manually enter the data fields and click Submit as before. To link the caregiver with the shelteree, go to the main menu and click Situation, and then click People Tracking. A list of people registered in the shelter will appear on this page. To find the shelteree that is already registered, scroll down the list or use the search term field located at the top of the People Tracking screen. On the right side of the screen, under the search term field, use the down arrow to select Search by Ames ID wristband or the last name of the shelteree. On the left side of the screen, if searching by the shelteree's last name, you can type it into the field and click Search. Or if searching by the Ames ID wristband, you can scan the shelteree's wristband and click Search. When the name of the shelteree appears, click the blue edit box at the far right of the screen. An Edit a Person screen for the shelteree will appear. Scroll down to the Add Relationship box and click to select. A gray box with the Ames ID wristband and relationship type will appear. Place the cursor in the Ames ID wristband field, scan the wristband of the caregiver to be linked, and press the Enter key on the computer. The Ames ID wristband and the name will appear in the box. You can also manually type the name of the caregiver, which will populate the caregiver's name and Ames ID wristband. Use the down arrow on the relationship type field and select Caregiver. If multiple individuals are being linked to the shelteree, click the plus add at the bottom and repeat the steps. From there, click Update. The message Saved Successfully will appear at the top of the People Tracking screen. To verify the relationship that was linked from the list of current shelterees, click on the Ames ID wristband of the shelteree and scroll down to the bottom of the page to view Relations. We will now be moving on to moving a shelteree to another medical needs shelter. A move is defined as a shelteree being moved from one medical needs shelter to another by state transportation. A shelteree who leaves a medical needs shelter in a non-state vehicle, such as a personal, caregiver, or family member's vehicle, must be discharged, not moved. The following instructions should be used when moving a shelteree. From the main menu, click Situation, then People Tracking. From the list of people current in the medical needs shelter, locate the person or persons to be moved using the search methods outlined above. When the person is found, click the box by the name, then click Move Discharge button above, and then select Move People. Place a cursor in the destination field and type MNS into the destination field, and select the name of the receiving medical needs shelter. All medical needs shelters locations start with the abbreviation MNS, so it will populate a list of all current medical needs shelters in the state. Place a cursor in the Reason for Move field and type in the appropriate information. This is a required field. Place the cursor in the Comment Instructions field and type in the appropriate information. This is also a required field. If there is not any information that needs to be relayed, you can just put NA for not applicable, but you must insert something in both of those fields. Click Submit. The message, "People were moved successfully," will appear at the top of the screen. When you hit Submit, the Ames Transport Manifest screen will appear. You will select the Download button to print or download the manifest and send it with the shelteree or shelterees being moved. It will be given to the staff at the receiving medical needs shelter. Next, we will review how to complete a move by the receiving medical needs shelter. When a shelteree arrives from another shelter, from the main menu, click Situation and then select People Tracking. Simply click on the Complete Move button. Then place a cursor in the Ames ID wristband field. You will scan the wristband or manually enter the Ames ID from the previous medical needs shelter and click Submit. A move has been completed successfully message will appear at the top of the screen. This completes the move, and the person will now show up on the receiving medical needs shelter list and will also appear in the moved list of the originating shelter. Now we will move on to discharging a shelteree. A discharge is defined at the point in which a shelteree is no longer being cared for by the Alabama Department of Public Health in a medical needs shelter and or leaves a medical needs shelter in a non-state vehicle. The following instructions should be used when discharging a shelteree. From the main menu, click Situation and select People Tracking. From the list of those registered, locate the person or persons to be discharged using the search instructions and the registration instructions. From there, you will click Move Discharge button and select Discharge People. Place a cursor in the Reason for Discharge field and type in the appropriate information. This is a required field. And click Submit. A message stating the selected people were discharged successfully will appear at the top of the screen. This completes the discharge. We will now show you how to view the list of shelterees who have been moved or discharged. The system allows staff to monitor people who have been moved to another shelter or discharged. From the main menu, click Situation and select People Tracking. This will provide a list of people currently registered. You will scroll to the right side of the list and click on the drop-down arrow in the Current People box and select Discharged or Moved to view those individuals. Now we'll review how to close a shelter in Ames. After all the shelterees have been discharged or moved, the shelter nurse manager will be notified to close the shelter. Follow these instructions to close the medical needs shelter in Ames. From the main menu, click Status and select Update. You'll then click Closed. Again, add any comments in the note fields as appropriate. Then click Send Update. A status updated successfully message will appear at the top of the screen. And here's a screenshot of the steps to to close the shelter as just described. Finally, we will review how to log out of AIMS. Log out of AIMS from the main menu at the top right of the screen. You will click on the drop-down arrow and select Log Out. Last but not least, we will review how to reach AIMS support. The information presented today is included in the Medical Needs Shelter Operations Manual. If you have any questions or need assistance with AIMS, you may contact the University of South Alabama Center for Disaster Healthcare Preparedness by calling 251-461-1805, or you can email support@aimslive.org. Also, while you're logged into AIMS, at the bottom of each page, there is a link to the contact information as shown on the right side of the screen. I hope this information has been informative and beneficial, and we thank you for your time. Thank you.
Thank you so much for attending this training, and I hope that you've been able to pick up information that you didn't already know. If you're a seasoned employee and if you've been have been involved in multiple responses, this hopefully will just be a good review for you. If you're a new employee, we hope that this is not intimidating, but we would like for you to know the importance of all of our employees to be prepared, to be trained, and to be ready to respond. All employees could be potentially called up to respond, whether, again, it's something within your office where you would just do more of your work at a county level, at an area level, or to potentially go out with a team. We want to make sure that for us to do our best, we need to make sure that our employees have an understanding of what their role would be. For medical needs sheltering, this is a very good overview of how this would work during a disaster. If you have any questions that weren't answered here today, we do advise that you follow up with your immediate supervisor. If they don't have that answer, I'm sure that they'll work that through the chain, but I'm sure that they will have the answers that you need. We never know when a disaster will hit, but we know that the public would depend on us as the ESF 8 lead to make sure that the public health and medical services are taken care of during a response. Thank you very much for your attention, and I hope that this was beneficial training.